Actually, yeah, just want to talk to you a little bit more about diabetes. Let you know how things are. The second part of what's going on. Last week we talked a little bit about diabetes. We defined what diabetes is. Kind of gave you some risk factors for diabetes. Gave you some numbers regarding diabetes. Just trying to get people aware of what this condition is. What this, when people say diabetes or the sugar, because remember a lot of people do refer to it as sugar, but it's diabetes. We want people to know what that is, and who's at risk for it, and kind of some key tests, how you get screened for it, and where you can go to get a little bit more information. So that was last week, and of course we also pointed out this condition called prediabetes, which is a condition that is right before where you're at high risk of converting to quote unquote real diabetes, I guess if you want to call it that. But yeah, so that's kind of where we were. We kind of ended off last week. This week we want to talk a little bit about treatment complications and taking control. Because when it comes to diabetes, this is a condition. It's a very serious condition, but it is a condition that you can learn, about, that you can be aware of what can happen, and you can actually learn to take control of this condition. And I can't say that you won't get some of the consequences of having this condition over the long term. But what you can do is you can delay it for a lot of people, and some people can actually prevent developing certain conditions. And so that's what we want you to do is to know, what your role is, what options you have available for you, so that you can take control of this. One of the big things I like to, some of these conditions I really like to think of, it's almost like you're almost fighting a war, but you're fighting a war today to win in order to win tomorrow. And the reason I say that is that because so say in amputation, so that's one of the things that happens with diabetes when it gets real bad. You can get an infection and that foot has to be amputated. But kind of if you fight today to get those numbers better and to learn how to recognize stuff, you can prevent an amputation, in 5 or 10 years, right? So it's kind of a tomorrow. It's kind of a tomorrow war, and that's what we're talking about here. So we armed you with what this stuff looks like, and now we're going to talk a little bit about kind of the basics of treatment and management. And I always want to stress, every time how we always have to remind people, we have to put a disclaimer out there that I'm a doctor, but I'm not your doctor. Okay, so make sure that you reach out to your doctor about questions specific, what we call specific medical advice for you and your condition, because that's how you get your stuff under control, because this is for education and entertainment purposes only. Okay, but we're going to talk about the basics of treatment and management of for diabetes, because that's highly important that you know what options you have available out there. And we won't go through specific medications and stuff of the nature, but we'll just talk about kind of a general medications. But you can get to when you get your specific medical advice, that doctor will talk a little bit more about that. So remember, we talked about that there are more than one type of diabetes. So there's a type 1, there's a type 2, there's what we call gestational diabetes, and really I still throw pre-diabetes in this category as well. Okay, so type 1, remember, type 1 is the one where your body does not make insulin. Okay, if you give yourself insulin, it'll respond normally, but your body doesn't make the insulin itself. Okay, type 2 is a type where your body makes insulin, but your body does not respond to the insulin that you have in there. Okay, and then gestational diabetes is when you develop diabetes during your pregnancy, and of course pre-diabetes is that state, in between having a normal physiology and having actual diabetes. Okay, so what we call core pillars? What are the core pillars for all types of diabetes? Okay, and I would say that there are probably 5 things that are in common with everybody. Okay, so one is a healthy eating pattern. Okay, so you want to eat consistent meals. You want to eat fewer highly processed carbohydrates, and you want to consume more fiber. I mean, this is just kind of, this is real general. When I say this is real general, okay? But you want a healthy eating pattern. Okay? So the things that other people are eating, like, hey, it doesn't work for your body as well. Okay. So that's one thing you want to remember is a healthy eating pattern. Number two, regular physical activity appropriate for age and health status. So, if you're a young person, because remember, especially for type 1, because type 1 can affect you as a young person, you want to maintain your physical activity. Now, you do have to learn how to manage your insulin levels, so that you don't risk getting low blood sugars. But definitely for all the adults and especially for people with type 2, you want to make sure that you get that regular physical activity in there, because that is actually very important for helping your body to manage the blood sugar. Okay. All right. So you got that weight. And number three, weight management. This is especially important in type 2 diabetes and pre-diabetes. This is a big risk factor for those two. So you want to maintain that normal weight. The way most of us use is most clinicians are going to use is going to be what we call the BMI, that body mass index. And I like to tell, because there's all sorts of complaints about it. And so can you have a high BMI because you have mostly muscle? And the answer is yes. But typically, if you're not in the gym, and you're not doing push-ups every day, your weight is probably not from muscles. Okay, it's probably not muscle. It's more than likely what most people get, and that's adipose, and that's the stuff that doesn't respond as well to insulin. It's more insulin resistant. Okay, so I tell people to use the BMI as a nice gauge. If there's any questions, like I said, say you are a bodybuilder, your BMI is elevated. There are ways to actually evaluate to see whether or not you have how much fat you have on your body. There are ways to actually measure that. Okay, so that's core pillar number three. Then of course, number four is going to be monitoring your blood sugar with different home meters, or they actually have these things, and they've been out for a while, but a lot of people still don't know, because if you're not diabetic, of course, why would you, right? And they're called continuous glucose monitors, CGMs. These are devices you actually attach to yourself, and they actually just continuously monitor your blood sugar. So they'll tell you when your blood sugar is going high, they'll tell you when the blood sugar is going low, and it really can. And I've had a number of people who received them, after we referred them to an endocrinologist, and they really feel like it empowers them to understand what's going on with their body, and it's really good at for people to understand what happens after meals, because a lot of people will be eating things, and like I said, now that you'll eat something and you'll see your blood sugar rise, and so you now understand, hey, this is like I said, you can do almost experiments for yourself, where you eat one food, you watch your blood sugar, and then the next day you'll eat a different type of food, and maybe it's more healthy, and you'll see that blood sugar doesn't go as high as it does when you say you're eating a cake or a cookie. And so that's one of the good things about continuous glucose monitors, is that it allows you real-time evaluation of your blood sugar throughout the day. And so, like I said, that is something that is an option out there. So it's monitoring your blood sugar. And of course, there's also the finger pricks, which I think everyone, most people know about the finger pricks for blood sugar, but you do want to monitor your blood sugar. You want to monitor it on a regular basis, as prescribed by your clinician. Okay. And then number five is going to be your medications, when needed. And of course, for type 1s, you're always going to need insulin. Okay. So you're going to need that. And for type 2 and prediabetes, there will be certain medication you need. Now, a lot of times especially in the past, the type 2s would start out with pills to kind of get them started. And that would be how you manage your type 2 diabetes. And then as time went on, like I said, a lot of times they would wind up going to insulin as well. Now we have some different medications. These are pills as well, what we call the SGL2s. And also the injections that are used. Well, they're known for weight loss, but they're actually diabetes medications, the GLP-1s. And so those are newer medications that are available to help to manage your diabetes. Okay, so those are the five core pillars for kind of what you do for your diabetes, no matter what you have. Okay, healthy eating pattern, regular physical activity, weight management, monitor your blood sugar and medication when needed. So as we're going to talk a little bit about type 1, of course, they require insulin. And so a lot of times it's going to be multiple injections throughout the day. Now, they do, yet again, this is another area where they have some newer technology, and it's called an insulin pump. And so that insulin pump, you kind of insert it and actually you change the pump out. And like I said, it's able to give you insulin whenever needed. And so for type 1s that are difficult to control, this might be a better option. So like I said, a lot of times you want to chat with your endocrinologist or your primary doc if they do those, just to see whether or not you're a candidate for this insulin pump. Okay. You want to monitor your blood sugar on a regular basis, or with the, as we said before, the continuous glucose monitor. You'll be sure to ask for that. And then, of course, also meal planning to match the insulin and carbohydrate intake. There's a method called carb counting where you can actually calculate the number of carbs for your meal, and then, like I said, give yourself a little bit more, a little bit less insulin based off what you're eating. Okay, so kind of cool. So, type 2 diabetes, one of the core pillars for type 2 diabetes is lifestyle changes. Lifestyle changes really does help a type 2 diabetic to manage their blood sugar. So, you want to make sure you're starting out with that, including some of the stuff we talked about before. And then, like I said, a lot of times they start out with oral medications, or they may nowadays may start out with some of the injectables, such as the GLP-1. That's the ones that are known as more of the weight loss stuff. And so you can also start up with that. Then there's the blood pressure and cholesterol control are usually crucial because a lot of the type 2 diabetics, type 2 diabetes is actually, I guess diabetes in general, but especially type 2, it's a risk factor for heart disease. And so you want to make sure that blood pressure and cholesterol are controlled so you can protect the heart and the kidneys. Okay. So that's the type 2. Then we go to the gestational diabetes management, and that's going to be meal planning and physical activity as approved by your OB provider. So if you got gestational diabetes, you should have an OB on board. Okay. So make sure you have your own getting those prenatal checks. Well, I guess, your checks by your OB provider. Make sure you're getting blood sugar monitored several times a day. Sometimes they might get some insulin as well. So like I said, yet again, this is all up under the OB. The hand is all over the OB. You're at high risk. Okay. So make sure you have somebody on board. And then one of the things is that after delivery, because remember, gestational diabetes sets you up for a risk for diabetes later. So don't think that because you've delivered and maybe your blood sugar normalized after delivery that everything is over. You still have to maintain those regular checkups and making sure that somebody is checking to make sure that you're not developing diabetes 1, 2, 3, 4, 5 years down the line. Okay, so to make sure that is very important. Okay, so we talked a little bit about kind of the basics of treatment and management. Okay, so we talked a little bit about that. So next we want to talk a little bit about who is on your diabetes care team. Okay, we want to make sure that we know who is on your diabetes care team. Why? Because knowing who is on your care team, you can go from one person to the next. Or if you don't have your complete care team, then guess what? You can also ask for people. Hey, like I said, look, you have a primary care clinician and things, your blood sugar is not under control, then you can ask for an endocrinologist. You can ask for, a diabetes education. So that's why it's important to understand, what comprises a diabetes care team, so you can know who's on your team, who do you have on your team, and who do you need to add, or if things are not going well and things of nature. Okay, so let's go down this list. Okay, so your primary care clinician, primary care physician / clinician, and so that's your family doctor, your internal medicine doctor, if you a nurse practitioner or physician assistant. So like I said, that's going to be your primary care person. This is going to be your point of contact. This person is going to be, they probably have diagnosed you with the diabetes and also kind of started you on some of your medications. So that's your primary care clinician, like I said, and everybody that's listening should have one of them. Okay, whether you have diabetes or not. Okay, now if you feel like the diabetes is not under control, and that is by monitoring the hemoglobin A1C on a regular basis, then a lot of times then you're going to want to get to an endocrinologist. And this is an endocrinologist. I say that They specialize in hormones, so like thyroid and things of this nature, but they also are diabetes specialists. Okay, so that's one of the things they're known for, diabetes specialists. And so getting referred to them, they can kind of take a look and see if they agree with a treatment plan that you're on right now. They can do extra reinforcement as well. So endocrinologists are actually a very important part of your diabetes care team as well. Okay, and if your diabetes is not under control, if you're not reaching your targets, then you want to request a referral to an endocrinologist if needed, if you need some extra help getting things under control. Okay. Now, then you want to make sure you have an eye doctor. Okay. And because you should be getting yearly exams, you have diabetes, you need to get a yearly eye exam. Actually, everybody needs to get some eye exams, but for diabetics, you need yearly eye exams, preferably the dilated ones. It's an ophthalmologist or an optometrist. An ophthalmologist is a physician, MDDO, that specializes in eye care. Optometrist is a clinician. The ones that you see, like maybe at Walmart and stuff of the nature. So these are going to be more your optometrists. Okay, so they can also screen your eye for damage and what they're doing is they're looking for damage to your eyes regarding from diabetes, and so that's what they're looking for. So so you want to make sure that eye doctor is on your diabetes care team. There's somebody called, the next one's going to be what we call a podiatrist. Okay, the podiatrist is for foot care. For diabetics, monitoring your feet is essential because we'll talk a little bit about it down in a little bit. But so what happens is with diabetes, you can get what we call small vessel diseases, and it can lead to your feet becoming numb, or you can also get wounds on your feet. And what can happen, in worst case scenario, what happens is that people develop wounds, but because they can't feel their feet because of diabetes, that wound gets worse and worse, and you can get you get bad infections, and you can require amputation if they can't get the wound under control. So you need a podiatrist for foot care. As a matter of fact, one of the things that should happen is that if you have a diagnosis of diabetes, when you go to your doctor, when you go to your nurse practitioner, if you go to your PA for your routine visits, somebody should be looking at your feet. Your shoes and socks should be coming off, and somebody should be looking at your feet on a regular basis, making sure that there's no wounds on there. They actually can do what they call a monofilament test as well. That's checking for diabetic neuropathy, but that should be done. And you should definitely have the name of a podiatrist in case you have any issues. Some people, especially people that have really bad diabetes, sometimes they will even get their nails and stuff trimmed by the podiatrist because they just don't want to risk anything happening to them. Okay, so make sure you got make sure you're getting your feet taken care of, and make sure you have a podiatrist on the team. Okay, all right, so that's another person. Then you want certified, if you can, get a certified diabetes care and education specialist for diabetes education and support. Now, this is something I want everybody to hear. Okay. If you have diabetes, you need some diabetes education. And more than just, and for 90% of the people, more than just what you get inside your primary care clinician's office. You need to understand what's going on with the diabetes. You need to understand what kind of diabetes you have, how to take care of it, what you're doing that may be right, what you're doing that may be wrong, what do you need to look out for. And all this stuff is covered under diabetes education. Okay. So if your numbers are not absolutely pristine, you need to go for diabetes education. If you're listening to me now and you have a diagnosis of diabetes and you don't know what a hemoglobin A1C is, you need diabetes education. Okay. Somebody needs to refer you for diabetes education. You need to understand what you have. You need to understand this condition, because I've seen way too many people, and this is just, from my clinical experience, seen way too many people that have diabetes that's not completely controlled, and they have never seen a diabetes educator. Okay. So you need it. And I'm telling them stuff that's completely new to them. And of course, by the time they're seeing me, is because they got kidney disease from the diabetes. So you need to make sure that your loved ones, that is something that you're taking, you're taking care of, because they can help you with carb counting. They can help you, like I said, if you're taking insulin, they can help you with carb counting, learning how much insulin you give for your carb. They can tell you what foods are good, what foods are bad. You can get some of those questions answered. So make sure you're getting that diabetes education and support. Okay. All right. So we got that. So then you want a dietitian or nutritionist, and this is kind of complementary to the diabetes care. From what I've when I've seen some of these diabetes educators kind of do a lot of dietitian work. Some of the other Sometimes we just send them to a dietitian or nutritionist separately, especially if they have other comorbidities like they got. For me, of course, I'm seeing a lot of people with kidney disease, so sometimes I want them to be seen by diabetes care, and then I also want them to see a dietitian to kind of help work with the chronic kidney disease in there. So sometimes you need both of them. Okay, and then you have other folks that are on there. Your pharmacist that's going to help you with your question about some medications. Dentists, everybody needs to get some regular dental care as well. And sometimes, because you have these multiple comorbidities, some people get a little depressed and anxious. So make sure you have a mental health professional. Go talk to a counselor if you need that. Make sure you got plenty of support from that standpoint. Also, community health workers or health coaches can also be very important as well. So these are all the people you can add to your diabetes care team. Now, as things go on, you may need some other specialists like a nephrologist. Oh, that's me. Or a heart specialist, depending on what's going on with you. Okay. All right. So now, when you want to make sure you're getting the specialty care, so especially if you have trouble getting your blood sugar under control, despite medications, and you're being prescribed medication, you're taking the medications, and things just aren't going as planned, that's a great time to be seen by a specialist. So you might want to ask about that. Also, if there are any signs of complications, then you want to make sure that you're being seen by specialists, and especially with vision changes, numbness in the feet, stuff of that nature, recurring sores, frequent low blood sugars, anything that's just not usual. Always ask for specialty referrals. Now, of course, if you're pregnant with diabetes either before or someone tells you got blood sugar that's high, make sure you're being seen by the right person, because gestational diabetes can lead to complications for the mother and for the child. Okay, so make sure you take care of that. And then, of course, if you got advanced kidney disease, high risk for kidney failure, then, like I said, you want to be getting screened. That albumin test is especially important. Come to see kidney specialists earlier rather than later. Okay. All right. So now we covered, kind of the basics for everybody. We covered, your diabetes care team. I want to talk a little bit about, the complications of uncontrolled diabetes, because because a lot of people, I don't know if they don't know, or sometimes you don't want to accept what's going on with you or your body, but like there are complications of uncontrolled diabetes, and they're really bad. Okay, they're really bad. But you need to understand that good control helps prevent or delay complications. Sometimes with diabetes, we can't stop everything that's going to happen to your body. But most of the time, if you got that diabetes under control, you should be able to delay complications from diabetes. Okay. Some you can prevent altogether, others you can delay. So, what do we want to talk about? So we typically categorize them into two broad categories. There's what we call a microvascular, or the small vessels complications, and then what we call macrovascular, or large blood vessel complications. Okay. So now the microvascular complications are typically the eyes, the kidneys, and the nerves. Okay. Macrovascular is usually the heart disease, stroke, peripheral artery disease. And okay, so let's go through the microvascular. Let's talk about what is going on in these what we call small vessel complications. So you got eyes, so there's diabetic retinopathy. This can lead to vision loss and blindness. There's kidneys, and that's what we call diabetic nephropathy. That can lead to chronic kidney disease or eventually dialysis. And then nerves is what we call diabetic neuropathy. And this is caused numbness, pain, can lead to foot ulcers and amputations. Okay, so those are the complications. So the eyes of diabetic retinopathy. This is like I said, this is I've seen people as young as in their 50s lose their sight, and it's because they did not control their diabetes. Kidneys, same thing. Like I said, uncontrolled diabetes can lead to dialysis, and it's a sad thing to see. One of the things that's also very sad to see, and especially for uncontrolled diabetics. And sometimes we see people that have, they actually, maybe for a couple of years, maybe 5, 7 years or whatever, they were completely uncontrolled. Maybe they're in denial or whatever is going on in life. They decide to turn around and get life under control. And, for a little while, maybe this kidney function stabilizes, then all of a sudden it drops. And the only thing that we find is that they had this history of really uncontrolled diabetes. And it seems as if that damage that was done before eventually catches up to them. Now, as far as we can tell, it still looks like, controlling it will still slow it down. But sometimes what happens is that later on, it's still like that damage still catches up. Okay, so that's why we want it. That's why we want like people to know about diabetes early. That's kind of why we're talking here today. It's kind of why you're listening. We want to catch the diabetes early. We won't get you under control earlier, so that you can delay these type of complications as long as possible, and preferably prevent yourself from developing them at all. So that's the microvascular. And then the macrovascular, that's the large vessels, and that's the heart disease, stroke, and peripheral artery disease. And so heart disease, okay, heart attacks, heart failure. Okay, that is what it is. Stroke, I think everybody knows what that is as well. And then peripheral artery disease, and that's poor circulation, especially in the legs and feet. And what happens that, when that blood can't circulate around, that's, when we talked about having a wound, and in order for your body to heal a wound, it's got to have blood flow. Okay, so when those arteries kind of get blocked because of the complication of diabetes, and you develop a foot wound and that blood can't flow down there, now you need certain other procedures in order to help get blood flow down there, and you're really hoping it can, because if it can't, then sometimes this can lead to amputations if we can't get that under control. Okay, so that's why we want you to take care of. Okay, and of course, as everything, as always, like I said, African Americans have higher rates of pretty much all these complications and end-stage kidney disease from diabetes. So this is why I'm talking to everybody, trying to get everybody to get this under control. Actually, number one, to understand what's going on, and then number two, to get it under control, because understanding is what'll lead you to, taking the meds when you have to take the meds, leading a healthier lifestyle. So that's what we try to get done. Now, we talked about, we kind of talked about a little bit of everything here. So we talked about, what we're dealing with, the basics of management, who's on the diabetes care team. We talked about the complications. And then, of course, we want to talk a little bit about, lifestyle management, which is something we kind of do with everything. But I just feel like diabetes, especially type 2 diabetes, is, that power is in that fork. Okay. That it really is the power in it. That power is really in that fork in there. Right. Okay. So you want to make sure that you're eating well. You want to focus on vegetables, whole grains, beans, nuts, lean proteins. You really want to limit sugary drinks, sweets, white bread, highly processed food. You just really want to get that out your diet. Okay. And then, you can, start using plate methods where you use half a plate with like more vegetables, more higher fiber foods. Then you might want to do stuff where you got like a quarter of the plate is like lean protein, and a quarter, more of a whole grain, if that. Okay. So try to find ways to make it easier for you. Physical activity, we talked about this before. Goal is 150 minutes per week of moderate activity. Things like brisk walking. You can spread it over 3 or 4 days. You actually want to add a little strength training, like 2 to 3 times a week if possible, and it's healthy for you. And this is I think we touched on it before. Strength training is designed to, first of all, activate that muscles, maintain your muscles that you have. If you can build a little bit more, great. But just remember that muscle is metabolically active, so it's going to help with burning calories. Also help you to. It's more sensitive to insulin than fat is. Okay. Weight management, even modest weight loss, 5 to 10% can improve blood sugar, blood pressure, and cholesterol in people with type 2 diabetes or pre-diabetes. Other lifestyle factors you want to focus on is quit smoking, manage your stress with prayer, meditation, counseling, or support groups. Make sure you get enough sleep, 7 to 9 hours for most adults, because one of the things that happens with stress is also what happens with people not getting enough sleep, and that is that you do release a lot of cortisol, and cortisol is bad for the body. Okay. And it's necessary for the body, but also like excess amounts of it can be bad for the body. Okay. So we talked about that a little bit, and then we just want to go back to this whole thing about diabetes education. I cannot emphasize this enough that it is quintessential that you understand what diabetes is and what you can do for it. So if you take these, like most areas are going to have diabetes education classes and support groups. Make sure you take advantage of that. Ask if no one's offered it to you, ask about it. And when they do refer you, make sure you go. Okay. And if you can't make it because your schedule is a little complicated, so say you work during the daytime, you can't get off at 5, ask them if they have some diabetes resources that are either after hours or maybe even online. But make sure you learn about your diabetes, what it is, how to manage it, and what happens when you don't. This is something that it is so important because I hate seeing people developing complications because they did not learn about the condition, or they didn't think to ask about this condition, or no one sent them to learn about this condition. Okay, because it is extraordinarily important to get yourself educated, learn what this is. You can take control of it. You got that power. Okay. All right. So now as we try to wrap up a little bit here, so I want to mention a couple of resources. So the American Diabetes Association, you can all get again. This is something you look up on Google. The American Diabetes Association, they can kind of help out with getting you some information. The CDC, they have a national diabetes prevention programs. This is especially important with people with pre-diabetes. We talked about this last time. Pre-diabetes is the ultimate red flag. It's a sign that, hey, you need to stop what you're doing, reassess your life, and get things turned around, because that's your opportunity. You can lifestyle. I have certified in lifestyle medicine. Like I said, there actually programs out there that get you under control, get your weight down, get you eating a little bit better, and people actually basically cure themselves of pre-diabetes. Okay, so that's your red flag. So CDC's National Diabetes Prevention Program. Okay, so we want to look into that. Then the National Institute of Diabetes and Digestive and Kidney Diseases. They have a lot of patient friendly information. And then, of course, if you look around in your area, like I said, usually the hospitals have access to programs like that. I kind of like I said before, health departments can they, if they don't have the program, they usually know who does. So that's another good source as well. So make sure you do that. So this is kind of wrapping it up for the day. So like I said, we kind of talked a little bit about diabetes. Make sure that we want to make sure that you kind of our call to action for the day is going to be, if you do not have a primary care doctor, make sure you get one. If you have one, you need to make sure that you've had your like I said, if you're in those risk categories, that you've had your screening for diabetes. If make sure you go and ask if you've been screened for diabetes within the last year. Okay, and if not, why not? Okay, you can always ask that question as well, and make sure you understand what a hemoglobin A1C test is for, and make sure that you know what your numbers are, and get yourself screened. If you have questions, feel free, or you want to learn more. Like I said, we have PressureMD Academy. That's what we have right here. You can find us on YouTube. If you want to, if you need some clinical, be looked at more clinically, like I said, pressure at www.pressuremd.com. Like I said, you can always reach out to us. Like I said, we can see if you're if you are a good fit for the clinic, especially with telemedicine. Like I said, we're in Ohio right now, looking to expand in North Carolina, hopefully early next year. So feel free to give us a call. And you can give us a call at 614-362-8542. Yet again, that email is our website address is www.pressuremd.com. So for everybody, thank you for listening. Thank you for tuning in. Like I said, we want you to stay, to stay healthy, get healthy. We want you to make it to being senior citizens. We want you to get old enough to, sit on your front porch and tell the young kids to get off your lawn. That's what we want you to do. Okay. So that's what we're aiming for. Outside of that, like I said, hopefully everybody has a great holiday. Enjoy your Thanksgiving. Make healthy choices and try not to eat as big a slice of pie. Okay. If it's going to be this big, cut it down a little bit. Okay. So try and do those things. Thanks for tuning in. We'll chat with you all next week. And as always, stay healthy. All right.
All right, ladies and gentlemen, you heard Dr. Dr. Brown here at WVOE with the health pack. Hopefully you enjoyed, and hopefully you are paying attention to him. We're going to continue here at WVOE 1590.
All right. All right. Thanks a lot. Thanks for letting us tune in. And we'll chat with you all next week. Okay.
Yes, sir. You do the same now.
All right. Take care. Bye-bye.